so much for joining us for today's session. The staff, that when they wrote it, they said, "Your good does great." And the person who's a science fiction in me wanted to flip it like Baby Yoda and say, "Great does your good." But either way you say it, that's the result. What you're doing by supporting the work of Seva is making sure that we're unlocking goodness and greatness across the planet. So we're here to discuss the impact of that support, as well as celebrate the lives you've helped to transform through eye care. Restoring sight isn't just about vision, it's about unlocking human potential. And when someone regains their sight, they return to work, or they go back to school, they can care for their family, and they contribute to the community. And that ripple effect, it's powerful. We've always known this intuitively, but now we get to prove it economically and with data. Last year, Seva published a groundbreaking study that inside of the Bulletin of World Health that shows that for every $1 you put into eye care, you generate $36 in social benefit. And what that means is there's more living, there's more learning, earning, productivity, and at the end of the day, human dignity. I'm often asked, what's the long-term impact of supporting eye care? And why is it one of the best investments that somebody can make? And it comes into three buckets. First, it's low cost and high impact. Current solutions show that for $10, you can provide someone with a pair of glasses, and within a year, they're going to have a very different trajectory in their life. For children, when they get glasses, they have a 78% increase in their lifetime earning capability. It's the best use of the dollar because for $1 every 36 returns in refractive error, cataract correction, it's 6 times more efficient than the sort of development interventions that might take place in other sectors. So as a healthcare issue and as a development issue, investing in sight is unbeatable. But numbers only tell part of the story. Today, I'm really thrilled to be joined by 3 people who are going to bring all these stories to life. You're going to meet Sunita, who has helped train more than 2,000 eye care professionals. You're going to meet Kuldeep, our Seva's regional director for all of the programmatic activities and partnerships that we work with in Asia. And then there's Dr. Mariano Yee. He's chairperson of the Seva Foundation board, and he's also the founder of Visualiza, which is Guatemala's largest, most effective hospital, providing care to millions and millions of Guatemalans. So together we're going to explore how simple pair of glasses or the 15-minute cataract surgery or even training a worker can have this chain reaction that lasts generations. So thank you, everybody, for coming. So I'm going to start with you, Sunita. Hi. So we know sustainability is at the core of our work, and we want our eye care solutions and programming activities to thrive, even long past our own kind of immediate involvement as an organization. And I think one of the big keys is Seva's commitment to empowering that next generation of eye care professionals. So I was wondering, could you share your experience through the training programs and maybe it's through Seva's training programs and how it shaped your life in the communities you serve?
Yeah, thank you so much for having me here. Uh, Joining Seva's training somewhere in 2014 was truly transformative, and the experience was great, and it kind of turning point for my life. I kind of new to IKEA. I was not in IKEA before joining this our organization. So for me, it not only gave me technical aspect of IKEA, but it was beyond. It instilled a passion, a purpose, and confidence in me that I can do, and it also helped me to have self-belief. Before Seva, I can say I was a trainer, but after Seva's training, I kind of become a torchbearer, wherein I was not only able to work or empower myself, but also become a powerful conduit for a change and to impart trainings to others. So I'm very happy that I was part of such a training wherein your potential is explored. You are given a pathway and you are also time to time supported wherever you need to. So through this program, because Seva's values resonated with the values of our organizations, which is why we could do more than 2,000 uh, young women. We could train them as allied ophthalmic paramedics through 2 years training program. And entire training is for young women who are from bottom of pyramid. So besides that, I could also reach after getting trained to around 250 health professionals who in turn are creating such kind of a cadre. So it is really wonderful that only one training changed almost everything, changed my journey, changed my way of thinking, and also not only taught me how to train, but why to train also. So I feel that this training shaped me and also created a ripple effect for many to follow, because through this training program, I could touch more than 1,000 lives, and those more than 1,000 lives in turn are now a change maker in themselves. They are individually a story of transformation. We feel strongly that investment in a person or in a human being, and especially because we are dealing with young women who are from bottom of pyramid and haven't been to the best of the school, and we are able to identify and giving them a purpose of life when they are kind of considered as second class of citizen at their home, and no one think of them as a member, active member, but a silent member at home. So it was kind of, or it is, I should say, is changing their lives totally. Now they are considered very useful member, and wherever and whatever the decision making they have to make, they are involved in it. And besides that, when we talk about hospital, uh, usually if I talk about eye care hospital, any thriving eye care hospital would be such that just not have equipment or infrastructure, but who have empowered efficient and skilled manpower. So through this program, we could do that. Earlier, our hospital used to struggle with how to have smooth OPDs so that patient can feel relaxed. They know that they'll be taken care of. In our hospital now, each and every patient is heard, seen, and taken care of. So now they are dealt with empathy. Quality of care has improved. Number of patients seen have increased. Let me give you an example. Now, after we have kind of trained in year 2022, we have trained more than 500 in a year, and after next year we could see that there was a jump of 30,000 surgery, because in 2022 we used to do 30,000 surgeries in a year, but after adding 500 more young women into as a pipeline, as a human resource, now we could do more than 60,000 in a year. So that was a huge jump when it comes to surgery. And same goes for when it comes to doing the OPDs. So they are now kind of, I would say, symbol of hope, where patient can trust them more. Patient feel that they are safe. And even if we want to ferry a patient who is very old, they know that whom to ask for the direction, who will be able to help them and guide them and answer their questions very patiently, because we have such a cadre wherein we have patient educator also. We have medical record assistant who will listen to them carefully. And also, we feel that there is something, a total change when it comes to, because now we have better healthcare systems made after we have now this strong cadre, empowered cadre with us, because they are from the local communities. They understand the needs of the patients. They are now responsive, and our hospital is not kind of I would say reactive in care, but proactive in its care now, because through them they are able to reach to the last mile. We When I joined somewhere in 2014, we had 28 vision centers, because, and now in this year, we are proudly, we can say that we have 111 vision center, and more than 60% are women, I would say, because they are the one who are handling all the vision center, and 43% surgeries are referred from these vision centers. So there are many success stories, and there are many powerful transmitted stories, because each person, if we talk to them, have a story in itself, because they are the one who were initially only milking the cows, or maybe making the cow dung cakes at home, but they feel that it was they used to they were used to afraid of dreaming, but now they are kind of very confidently managing minor OTs independently. They are the one who used to earlier afraid of whispering. Even now they are kind of confident, and they are able to say what they are want to say. They are willing to debate also when it comes to their rights, so they know their rights. Some personal note, I would say that they feel that now they are not only able to help themselves but to their family members also, because they are many of young women are helping their siblings so that they get better education. Many of I think more than 80% of our young women who were only 12 pass when they joined us are graduates, and more than 30% are postgraduates, and many of them are doing optometry, masters in many things, because they understood the importance of education, and more of having kind of a mindset of progression, because they feel this is not the end, this is the beginning, and they are the one, and I feel very happy that I could be part of such a journey, that wherein I could be a kind of I can say linchpin between their hopes and opportunities, because they were the one who were really scared when they come, but now they are the one who can uh, dispel the fears of any patient or anyone who approaches them with a question.
That is so beautiful, Sunita. Thank you so
Anything else?
I'm gonna move forward with Kuldeep, but I have to say I've been frantically writing so many of your wisdoms and your linchpin between hope and reality. I think that that really describes Kuldeep, who I'm gonna turn some of these questions to, but you did a wonderful job, I think, painting that picture. I remember the first time I saw the effect of the trainings that we do in the young women and men who then go on to be help support ophthalmologists through that mid-level training, and just the I call it concentric circles of good, that not only are we delivering important world-class work, but how we're doing it through the eyes and hearts and minds of local men and women. And I couldn't agree with you more about this notion of this being kind of a symbol of hope for their families and for their own journey in terms of education. So but stay with us, or stay with me, because I want to turn and have some questions for Kuldeep,
Sure,
and then I think the three of us are going to have a chance to talk.
sure.
So Kuldeep, you're on the hot spot now. So well, first of all, you've saved me from falling out of a bus in Kathmandu. So you and I have history. You lead our programs across Asia and have really seen firsthand how increasing access to eye care can transform an entire community. So let's take a few steps back. Maybe talk to me a little bit about why investing in eye care is one of the best investments, and then what's the urgency, like especially when we think about kids.
Thank you so much, Kate, for this question. And also thanks to Sunita ji for sharing the story of transformation just now. Uh, as we know, 80% of what child learns, they are processing it visually. So sight is not just a way for them to knowing and interacting with the whole world, but it allow them to learn and become professional, to get education and also develop themselves. We have seen and we know there is a millions of children who are either blind or visually impaired. But what we see in our program that each of these numbers have one story to tell. If one children cannot see well or have some eye conditions, they will immediately be falling behind in their school performance. They will not be interacting with other children in the same way as they should and they have potential to do. And then more importantly, they are not being active part of the community or the school or the family where they are. And the difficult part of it is that they don't know why they are not doing. So most of the people who doesn't know the children have an eye condition, they will say children is shy or children is having some issue. So the first impression that you get from the school teacher or the group of the children that this child is not putting his 100% or her 100%, or they are not as per the equivalent to the other children in the class, which is not true. But the realization of it, they are not able to see. That is why they are not able to perform. So it's related to their confidence. It's related to their everything they think, interact. And then there is a lot of study which says that uh, any children who is having access to the glasses at the right time, they will perform better in the school. They will be a better citizen outside of the school and also be more better part of the family where they are. Seva also have came out with the research that says 5-year-old who receive the glasses in the grade school and wears them can earn 70% of the more in their lifetime as an income. So just one pair of the glass, which actually cost very less in compared to what the potential of change it has, and also how it can earn, it can help in the transforming the life of the children. I'll share one quick story. Last summer, I was in one of the vision center we started in the somewhere in the western region of India, close to the city of Bombay, but outskirt. This vision center was in the slum, and second day of the vision center operation, there was a young child came with her grandfather, and she wanted to get the eye examination done. And the technician, the optometrist, did the eye examination, and she was very happy to get the glasses because somehow she was better able to see the everything that was written on the a chart. But then children start talking. We were interacting. The grandfather said, "Do you know her father are doctors? They are busy in their life, and now she has come. Her name was Gudia. We have this common name, but every young children is called uh, Gudia. And she was saying that they are so busy. They never thought that she may have some kind of a refractive error. And so now this is summer, she's here, and I just realized this vision center is just across our home. So we decided to walk here and see. So, and then she was very happy, giggling, and also saying that, oh, this is wonderful, how it can change so quickly the way I'm seeing. So these are the transformation, and we are doing it to the hundreds and thousands of children every year. So there is a story behind every single interaction as well as the every single services that Seva and partners provide. Some of them we are very fortunate to see them in real life. But a lot happens in those every single OPD number that we report through our impacts, or every single surgery that we provide to the children through our programs.
No, I mean, Kuldeep, I know that, that's my background. I'm an economist, and what I really valued about the work that we've done together, that you've spearheaded, is sort of taking a lot of the storytelling that Seva has had for decades and these are all very important. It's the human condition, it's these wonderful and diverse experiences, but you've helped to quantify. You've helped us quantify the economic value, because I think what we find in our line of work is, there's sort of the human justification for the work we do. There's the interpersonal and the human dignity, and it's really powerful to also say, but there's also an economic rationale for this. And I really want to thank you for not only leading that charge, but really helping us shape and think about the work in that unique way. I want to now turn the table to Dr. Mariano Yee. I don't know where to start, because you are so important to this mission. I call you Mariano, but I know you're Dr. Yee, and you wear your power so lightly and so lovely. We're very lucky to have you at the helm of the Seva Foundation as our chair. One of the biggest ideas and bold solutions that we have as an organization is something called Guatemala Brillando. And that idea started about 7 years ago. And our open-ended question was, we started our work in Nepal. And of course, as an Irish poet, the sun rises on the east. So the whole industry started in Nepal with that comprehensive epidemiological study. But what about proving that this idea can be solved with scale and money? And it was you and your team and your organization that helped us think through this idea that, because of the size of Guatemala, combined with the expertise of Visualiza, maybe we had a solution that could be a proof point for the rest of the industry, that we could eliminate avoidable blindness in a country within a lifetime. So you've established several vision centers. You've supported the development of eye hospitals. So maybe let's kick off our part of this conversation with what, in your opinion, is the long-term impact of investing in eye care infrastructure in remote communities.
If you can close your eyes for just a second, close your eyes and picture yourself in the rural Guatemala area, and you are blind and you don't have access to anything, because transportation systems in my country are really bad, roads are really bad, So if you are in that scenario and you have to walk 1 or 2 hours just to reach the bus that can take you to the city for another 3 or 4 hours, and you're blind, remember you're blind, so you're traveling with someone, and then you arrive to the city. You haven't been there for many times there, but you're in the city and you're lost, and then you are blind, and then how I can get to the hospital so I can get some help. So then you go there and you're lost, in the system, and then no resources, nothing, and then that's the reality for many people in Guatemala, or if you break your glasses, can you live without your glasses? If I lose my glasses and I cannot find them even for an hour, I feel like I'm lost, So when Seva helped us to build all these vision centers around the country, we are breaking that barrier, we are becoming more accessible to people. So people don't have to travel too far away to get the eye care they need, is right there. So are bringing people together. Even though Guatemala is a small country, I can say the distances are very large because all the barriers that don't allow people to get access, they don't know where places are. Bus transportation probably is, if it's there, probably is not accessible for them because it's too expensive. So think about all these economic barriers for the people. So by building these vision centers around the country, we are reaching the people who need it the most. And this is what is important, because sometimes we think about numbers, which is fine because we want to reach as many people as possible, but we want to reach the people who really need it the most. By having this infrastructure around the country, we are doing that. We are helping the people. We're bringing hope to these people.
No, you are bringing hope, and I've just seen the work firsthand, in terms of whether it's your work up in the Petén or out in Quiché, which is a community that you've just more recently expanded. So, Doctor, let's talk a little bit about the fact that Visualiza, you're really, again, I talked about you wearing your power lightly. Your Visualiza is a model for other countries, and part of the Guatemala Brillando's playbook is to be a learning environment or a learning center of sorts. So what do you think makes the approach that you've taken work so well? And why are other communities, especially in Latin America, learning from this particular journey?
Well, Kate, I can tell you that it's a smart way to make eye care affordable because you don't give everything away for free. Of course, you help the ones who need it the most, but also at the same time, people pay for the service. So you create a very healthy, economic, and sustainable environment where you can help the people who need it the most, and you can keep your operation running at the same time. So in every country in Latin America, we have these similar or these mixed economic levels, of the society. So this is one way that I think that it works, And the other thing is that we try to keep our costs low and have a high volume of patients, because instead of doing an expensive tech-heavy surgery, we do the manual small incision cataract surgery, which is safe, is affordable, and is cheaper than other types of surgery. And I can tell you that it's so precise and so effective that even when I have to do my mom's cataract surgery, I did it with that technique, and she's doing really well, So this made the system financially viable, even in poorer areas. And this is also another common denominator in Latin America. And the other thing that I can tell you is that that I have seen projects, really good projects in Latin America that, spark, flourish, and then die because they don't have external support. So by doing this and create a self-sustainable environment, you keep your system running and you keep helping people, The other component is that when we do these vision centers and hospitals around the country, we do also a lot of outreach. And outreach is not only a good charity, but outreach is also how you grow sustainable because you actually reach the people. And by reaching the people coming to your places, this is the best marketing tool that you can have, So what we're doing is not a strict formula, What we are doing is based on principles that can be adapted, You can change prices, you can adjust your workflow, you can do different outreach strategies, But at the end, what is really nice is that what we're doing is already rooted in Latin American realities. So it feels local, not important, and I think it can be done in any part of Latin America.
And it is being done. I mean, I know that Visualiza is the recipient of the Lavelle Fund, has collaborated with Seva to help start a training center for excellence. And so I think that I think that combination, that Visualiza and you and others bring to the table is that perfect combination of you have an expertise in what you do in terms of providing world-class eye care to people. You have a commitment to making it available to all people, which means you have to have a business model that is sustainable and diverse enough to address folks who can pay full value versus folks that might need some type of a subsidized support. And I know that you are currently mentoring and working with groups in Paraguay, Mexico, and Peru, just to name a few places. So I think as we're going to pause now and probably move it into all three of us sort of interacting, or all four of us, excuse me, interacting. But I think before I let the spotlight on you go, I would ask of you, what is the biggest thing you're looking forward to when Visualize is successful in the next 5 to 6 years and succeeds in its Guatemala Brillando plan? What would you look forward to if that were to become the reality that we're working so hard towards?
Well, what I would like to achieve with the help of the whole team is that people can earn and will have access to eye care any part of the country. If you lose your pair of glasses, if you need cataract surgery, if you have glaucoma or diabetes, you will find a place where to go because there is hope. And the other thing is that since our model is really robust, and is something that is proven already during the years, I would like to see Latin America doing what we are doing, Paraguay, Peru, Bolivia, everywhere, doing similar things that what we are doing. And you know what? When you mentioned that, Kate, Seva had been playing a really, really strong role on this because over the years, we had transforming people, changing the mentality of ophthalmologists all over Latin America. So we have been changing the way ophthalmology is delivered to the poor. So we have been doing many things, and thanks to Seva, we are changing lives.
All right, so maybe that's my rapid fire round of final questions. What would be for you, Sunita? What's either the big issue or the thing that's top of mind for you? Like, what are you looking forward to most in the year ahead?
If you talk about coming year, definitely we would like to have more young women touched and trained so that we can expand our services to remote areas. Recently, we have expanded to UP, another center we have opened. But now we are also planning to open somewhere in Bihar, which are because North India is such that has more blindness than South India, and we have less manpower. When we say there is lack of trained paramedics available, and because we know that in short term we can't create doctors because doctors is an expensive kind of manpower, but by having more such young women attached to us, we can also not only expand ourselves, but we also want to replicate our model to other, whatever the learnings we had. If now we can help other institutes also join hands, because alone in 10 years we could have around 2000 or more AOPs. But if we join hands and more organizations join, I think that day is not very far when we can more ably deal with unwanted blindness, and also through that able to touch various public health goals. Thank you.
So I'm going to start labeling our training initiative Sunita's Army. Oh, and Kuldeep, what would be a parting thought for you in terms of what you're most looking forward to in the year ahead?
Thank you. So we have come a long way. We are doing more screening. We're reaching out to more children, and they are maybe in 100,000 or 200,000 every year in India, a few more in Nepal, and things like that. But the actual children who need eye care or eye care treatment are in millions. So if we really want to reach everyone, make sure every single child get the eye care services they need, 100,000s, although they are huge number, but they are not enough. We need to do more, and we need to multiply them in very rapid way to be able to reach few 100 million people or the children who doesn't have eye care access. And Dr. Mariano's answer remind me one thing. Uh, Most of these problems are in the countries where we don't have I mean, people are not rich. I would say majority of them live $5 a day of the income. And for them, the importance is to get the food, to get the cloth. And if your parents are very visionary, they will put you in the school. But every other expenses, especially related to healthcare and preventive healthcare, which is where the eye comes in the pyramid of the priorities, it's not prioritized. So if you are not able to see until parents doesn't know, they are not going to spend money because they have to prioritize reducing some of their expenses somewhere to be able to go to the vision center or to the eye hospital. So if it is not an emergency, most of the family from the country I come from, or even from the larger region of Asia, they won't have ability, they don't have ability to take out the money which they have for regular need to go into the healthcare or the eye care. So this is another bigger reason why it's very urgent to reach out to the children, because one children reached, uh, we are going to change their whole life. So many aspects, their confidence, their learning ability, their ability to perform in school, the way they become the children in the society, and they become the citizen of our respective communities. So one simple thing have a lot of potential to do change within the one life, but also in the whole community. So we need to reach more people, a lot more people, as all of us are saying or in the ground. But more importantly, the sooner we reach, the better it is, because the change start from that point onwards.
Yeah. Wow, that's terrific. And I think a lot of us we agree with you. We feel that sense of urgency because we can do it today, we can do it now. It's a scale issue. It is one of the few, I think, problems of the world that money actually can solve, which is shocking to me that this is actually solvable. And it's about making sure that our partners and the men and women like yourselves have what you need to reach the people that you're already committed to finding and reaching. Thank you for that. Thank you very, very much. So, Mariano, I want to give you the last bite of the apple. What, you hold a lot. You are an ophthalmologist yourself. You are a founder of one of the most successful organizations in Latin America, and you're chairing the Seva Foundation at this point in time. And my wonderment would be, what for you, like, what is the thing that you're most hopeful for, and what's top of mind for you as you look at the year ahead?
Well, when I think about what is happening around the world now, there's hope, a lot of hope, And what I have learned is that things you cannot do it on your own, You have to create a good team, And I think that at Visualiza we have a really good team, and also you have to think about the strategy, And Seva Foundation and other institutions have helped us with that, Um, since we cannot do all of this alone, the minimal resources that you have to think how you can use them the best way you can, so you can reach all these people. Like Sunita, when she was telling about all that she's doing, I was thinking, this is job creation. You not only are reaching people, but you are also giving people an opportunity to succeed in their life because you are creating jobs. And when I was thinking about what Kuldeep was telling us, children are the future, because these kids who goes to your vision center, just imagine, just if it's just for a checkup, that is fine, but you are putting in their minds, that there's a place where they can go, and the word is spread around. So what I would like to see in the years to come is all these people getting access to eye care, and educate other people, and we can do this together.
Yeah, thank you for that. Well, thank you. Let's go back to thank you so much, Mariano. You each are that symbol of hope for us, that interconnective tissue. We're not alone because we have the talent of people like you, Sunita, that are training that next generation of caregivers and community outreachers, and helping to maximize the effectiveness of the ophthalmologists in the countries where we work. So, and then we have thought leaders and team members guiding overarching strategies and ideas in regions. And Kuldeep, what you've done for the Seva Foundation and the work it's the kind of work that's going to be looked at for decades to come. And none of this happens without the leadership. And Mariano, you're such a perfect example of the kind of thoughtful, kind, and committed leadership that we have at Seva, that cares as much about the data and as much about the science as we do about the human expression and the human experience. And when we talk about, and I've used this phrase before about Seva is as close to an absolute good as it gets, because my first trip, when I realized what we were doing, I realized that we really had one of the strongest job creation programs I had ever seen in my life. That this notion of investing in centers, vision centers that got closer to men and women through the daily tasks that they have to do, shopping, and that process of a vision center might be a pipeline for them to actually get additional care that they need in addition to on the ground care at that center, and that it was staffed by people that we trained that speak local languages and know the communities. I had to sit down because I thought this is remarkable. And I want to thank each of the three of you for what you bring to this work. We have a tough year ahead, frankly, and we might all be in the same storm, but we're not all in the same boat. And the Seva boat is highly resilient because of the talent and the love and the care that each of you bring to this. And I just, on behalf of staff and our constituents everywhere, I wanted to thank you very much from the bottom of my heart. So thank you for joining us today and sharing your stories. It's been a pleasure.
Thank you. It was an honor to be here and share the experience and learning whatever we gained from you all. Thank you so much for having us.
Thank you so much, Kate, for making sure we are on the prioritizing what needs to be prioritized, but also thank you so much for your leadership, guidance, and support all the time and every time that in what we do.
Well, thank you very much, and I would like to say something else. If you are watching us and if you believe in us and all the good that we're doing, don't be afraid to donate to Seva. Every penny counts. Whatever you donate to us have a ripple effect, and we are changing lives.